Non-communicable diseases, NCDs, known as chronic diseases, result from a combination of genetic, physiological, environmental, and behavioral factors and cannot be transmitted from one person to another. These diseases often develop slowly and last for extended periods, sometimes a lifetime. Based on NHMS 2023, an upward prevalence trend in NCD from 2011 to 2023 is diabetes, hypertension, and obesity among adults in Malaysia. Based on the NHMS 2023 NCD report, NCDs contributed to 72.0% of premature deaths and more than 76.0% of the burden of diseases. These conditions are responsible for the majority of deaths globally and pose a significant challenge to public health systems, especially in low and middle-income countries. COVID-19, short for Coronavirus Disease 2019, is a highly contagious respiratory illness. It is caused by a virus called Severe Acute Respiratory Syndrome Coronavirus 2. The World Health Organization declared it a pandemic. Due to lockdown, COVID-19 has also led to lifestyle changes that worsen risk factors for NCDs. For example, due to quarantine during lockdowns, many people have reduced physical activity, increased the consumption of unhealthy foods, and experienced higher levels of stress and anxiety. The pandemic has exacerbated the risk factors for NCD risks, which are dietary changes. Quarantine and physical distancing can lead to poor management of NCD behavioral risk factors, such as unhealthy diet. The most common comorbid condition in hospitalized COVID-19 are among overweight and obese patients. There is study that has been highlighted that obesity is a risk factor and increases susceptibility to COVID-19. Second is physical inactivity is one of the main factors for developing NCD and indirectly influence the progression of COVID-19 disease. Next is tobacco use. It can increase risk of developing several NCDs, and also it may increase the risk of COVID-19 due to the hand-to-mouth contact. Evidence conducted by WHO, smoking associated with greater severity of disease and death in hospitalized COVID-19 patient. Other than that, harmful use of alcohol can give negative effects on physical and mental health. Usually, alcoholic person is vulnerability to COVID-19 and may be at particular risk of acquiring a range of infections due to risk factors associated with alcohol use, sharing bottles and other containers. Lastly, environmental factors. Household and outdoor air pollution are the major causes of death from NCD. Secondhand cigarette smoke also impairs lung and immune function and probably increase the risk for adverse effects of COVID-19. In general, air population is associated with the development of these diseases. Exposure to higher concentrations of air pollutants can exacerbation of symptoms in people infected with COVID-19, which can potentially lead to comorbid conditions. Non-communicable diseases, or NCDs, are highly prevalent in Malaysia, with conditions like diabetes, hypertension, high cholesterol, and obesity becoming increasingly common. Among these, hypertension stands out as a significant concern. Often called the silent killer, hypertension frequently presents no symptoms, making it difficult to detect without regular health screenings. However, in severe cases, individuals may experience headaches and dizziness, which are among the most common symptoms, chest pain and palpitations, often signaling cardiovascular strain, vision problems and fatigue, especially in older individuals, nausea and vomiting, which are sometimes overlooked but can indicate severe hypertension. During the COVID-19 pandemic, hypertension has been associated with significant lung damage and a higher mortality rate, making awareness of these symptoms even more critical. By understanding and recognizing the signs and symptoms of hypertension, we can take early action to prevent complications and promote healthier lives, especially during challenging times like a pandemic. So what are strategies to apply? Individuals should be aware of their own health risks. This includes knowing their family history, engaging in regular health checkups, and tracking indicators like blood pressure, blood sugar, cholesterol levels, and body mass index, BMI. Local media platforms can air programs focused on educating the community about NCDs. By sharing real-life stories, expert advice, and actionable tips, these programs can reach a wide audience. Individuals should regularly participate in screenings to detect NCDs early, for example, blood pressure and cancer screenings. Early detection can lead to better management and prevention. Local health fairs, which can offer free screenings, health consultations, and informational materials on NCDs. Local residents can also receive guidance on nutrition, physical activity, and mental well-being. Individuals should aim for a balanced diet with fruits, vegetables, whole grains, and lean proteins. Reducing intake of processed foods, sugary drinks, and unhealthy fats can lower the risk of NCDs. Communities should support initiatives that increase access to affordable, healthy food in communities. This could include promoting farmers markets, establishing community gardens, and partnering with local businesses to offer healthier food options. Aim to fill half plate with a variety of colorful fruits and vegetables, which provide vitamins, minerals, and antioxidants. Incorporate healthy fats like avocado, olive oil, choose whole grain like oat, brown rice that packed with fiber, and maintain good digestive healthy. Prioritize sleep to allow body to repair and maintain optimal immune function. Aim for 7 to 9 hours of sleep each night. Practice stress relief techniques such as deep breathing and medication. Based on NHMS findings, we should focus on improving their intake of vitamin C and D and zinc. Leafy greens such as spinach help maintain a strong immune system. Cruciferous vegetables such as broccoli and cauliflower. Protein is essential for production of antibodies and immune cells that fight infections. Omega-3s help reduce inflammation, which is a key factor in immune response. Probiotics good for gut health as large portion of immune system locate in the gut. Globally, non-communicable diseases account for 74% of all fatalities. These disorders include diabetes, cancer, heart disease, stroke, and chronic lung disease. People with NCDs are more susceptible to COVID-19 and vice versa. In other words, having pre-existing NCDs increases the likelihood of contracting a severe form of COVID-19, which typically results in mortality. In contrast, COVID-19 affects the outcomes and complications of NCDs. To effectively manage COVID-19 and lessen its effects on people and communities, it is crucial to understand its risk factors, symptoms, and indicators. Since people with underlying non-communicable diseases, NCDs, are more likely to experience serious problems, proactive care and awareness are essential. With the right information, people and healthcare institutions may collaborate to lessen the impact of COVID-19 and safeguard vulnerable groups. Knowing their risk factors can help people lead better lives, which includes avoiding alcohol and tobacco and eating a balanced diet. People with higher education levels are more capable of managing chronic illnesses, which can lower hospitalization rates and ease the strain on healthcare systems in times of emergency.